Cataract surgery is an exciting opportunity to improve your vision and really set it up for the rest of your life. That being said, I see a lot of patients making the same mistakes when they're getting ready for cataract surgery. In today's video, I'm going to break down 5 of the most common mistakes that I see patients make. That way you can avoid them as you go through cataract surgery. Now before we start, real quick, my name's Brad Sifrig. I'm a board certified cataract surgeon, and this is the Cataract Companion YouTube channel. It's a channel I made to help patients go through cataract surgery feeling more comfortable so they can get their best result. All right, let's jump into it. Mistake number 1 that patients make, and probably the most common mistake, is not learning some cataract surgery basics before going in for that evaluation appointment. Many patients are surprised to learn that during cataract surgery, you're actually going to have to make quite a few decisions as far as what your goals are for your vision. Some of these decisions you'll have to make include what type of cataract surgery to have, whether it's done manually or by laser, what lens choice you might be interested in, what your goals are for your vision, and ultimately how much money you're willing to spend to get to those visual goals. Unlike most surgeries, you really have to think about what you want for your vision because there are different options available to you. Now, when patients come in for that initial cataract surgery evaluation appointment and they don't know that they're going to have to make decisions, it can be quite overwhelming and confusing. Oftentimes I find that when patients are feeling overwhelmed or confused or a little bit scared or afraid of the surgery, they make reactive decisions rather than really thinking about what they want for their vision in the long term. And some of these cataract surgery decisions are not decisions you want to make lightly. Really, the decisions you make during cataract surgery will set up what your vision is going to be like for the rest of your life. Now, I personally totally understand what it's like to have to make a decision, especially a decision around money, when you're feeling overwhelmed or like you don't understand what's going on. While I know a lot about eyeballs and vision, I know almost nothing about cars or automotives. Just recently, I was having a problem with my car where my battery was dying every few days and I had to get frequent jump starts. When I took my car into the mechanic shop, I was expecting a quick and easy battery swap, but instead they told me that I needed to replace the alternator. Now maybe I should have known what that meant, but I had no idea what he was talking about, and I sure wasn't expecting the price tag that came along with changing the alternator versus just swapping out the battery. Because of that, I made what in retrospect was a bad decision to just put off doing anything with my car and drove it home and continued to have to jump start it those next few days. After a couple days, realizing that wasn't a good solution, I talked with a family member who was much more familiar with cars. I told them the situation. They agreed that it sounded like a problem with the alternator. They recommended I go ahead and get the alternator replaced and gave me an approximate cost of what that might be at your average shop. Because of that, I was able to go back to the mechanic a few days later and make a good decision for my car that was coming from a place of knowledge and comfort. It is the same thing with cataract surgery. Having just a little bit of that basic background or understanding about some of the different options will make that initial evaluation appointment much less intimidating and much more productive. That's going to let you feel confident that you're making the right decisions to get to your vision goals. Before we go on to problem number 2, I do want to highlight that I've made quite a few videos that will help you with some of that background information. You can check out this video here where I go through a lot of the lens options available during cataract surgery so you can understand what some of the different lens types are and what you can expect from your vision with each type of lens. I also made a digital lens guide that goes through those same options and what you can expect with your vision with each lens type. This digital guide is nice because you can refer back to it later after you've gone in and talked about some of those options with your surgeon. If you want to download that lens guide, it's totally free. Just scroll down to the description and you'll see a link where you can have it sent to your email. All right, let's jump ahead to mistake number 2 that I see a lot of patients making during cataract surgery. And this is making decisions based entirely off of what your friend recommends or what might have worked for your friend. So this is probably just about as common as mistake number 1. As a matter of fact, I have multiple family members who've said the same thing to me. Well, I'm just going to do this because that worked for my friend Sue and she's real happy with her vision. The reality is in that a lot of purchases and a lot of decisions you make in life, that's actually a really great way to go about it. Having someone that you know and trust recommend a product or service to you is a great way to feel confident about it going in. The problem with that in cataract surgery is that everyone's eyes are unique, everyone's vision goals are unique, and just because something worked for a family member or a friend doesn't necessarily mean that you're going to get the same outcome. The best way to go about making decisions during cataract surgery is to talk about your vision goals with your surgeon, and they'll make some recommendations to get you to the vision that you want. But making decisions off of what worked for your friend or family member really isn't the best way to do it. Going back to our car analogy, this would be like having a friend with a really high, jacked up Ford F-150 talk about how much they love their new gigantic tires that they got for their truck. When it comes time for you to get new tires, you go in and you want the same exact tire, the same size and everything. The problem is that you have a Toyota Camry. Obviously, that's not going to work out well, and I don't think any car shop's going to do that for you. Similarly, eyes really come in different makes and models, and a lot of the results of cataract surgery are very dependent on the health of the eye, the specific shape of the eye, how much astigmatism you have, what your vision goals are, and even a little bit what your personality type is like. Your personality tells us how much you're going to accept a little bit of blur or side effects in your vision when we're thinking about different lens choices. So it's a great thing to listen to friends and to ask them about their cataract surgery experience, but really it's not the end-all be-all, and it's not the right way to make choices about your vision because it's going to be a different situation for your eyes. Mistake number 3 that I see a lot of patients make during cataract surgery is not asking questions or not getting all of their questions answered before the surgery. Now, in the busy shuffle of clinic or sometimes in the initial confusion as you're going through some of these cataract surgery options, I definitely see some patients who are hesitant to ask questions that they may have. With how important the decisions you make during cataract surgery are for your vision long term, it's important for you to have a full understanding going into the surgery. Make sure to ask your surgeon any questions you may have, whether it's about lens choices, about recovery, about what you can expect the day of surgery. They are more than happy to answer those questions to make sure that you're comfortable and confident going in. In addition to that, if you think of any questions after you leave that evaluation visit or between that time and the time of surgery, you can always call or email the clinic to make sure you get those answered. Now, I also want to highlight that this channel exists to answer some of those common questions about cataract surgery, and I've actually put together a pretty extensive playlist of frequently asked questions about cataract surgery. This playlist has answers to more than 50 common questions about cataract surgery. They're short, specific answers to specific questions that a lot of my patients have had in the past. So if you have a specific question about cataract surgery, make sure to go over to the channel and subscribe. Check out that playlist. There's a good chance I may have answered it there. Moving on to mistake number 4 that I see patients make when it comes time for cataract surgery, and that is thinking short-term for their vision rather than long-term. Now, during cataract surgery, there's different options you can choose for your surgery, including basic surgery that's covered by insurance, or premium surgery where we're using the laser or using some specialty lenses to get you more function in your vision. Many patients choose basic surgery a lot of times for financial reasons. There's nothing wrong with that. A lot of patients are very happy after basic cataract surgery, but there are some limitations to what we can get with your vision. It's important to consider the full picture, including the full financial picture, when thinking about some of those decisions. So I personally highly recommend having astigmatism corrected at the time of cataract surgery. There's always going to be some additional out-of-pocket cost to correcting astigmatism, but when you correct astigmatism during cataract surgery, it means that at least one zone of vision is going to be in good focus without needing glasses or contacts. Long term, there's going to be some cost savings to that because you won't need bifocal or progressive glasses anymore. You'll just need glasses for one range of vision. There's also the added benefit that getting rid of those bifocal and progressive glasses reduce the risk of falls. There's been a handful of studies that have shown those types of glasses actually increase the risk for falls in the elderly. Additionally, some patients choose basic cataract surgery thinking, I don't mind wearing my glasses or I don't mind wearing my contacts, I'll just keep doing what I'm doing after surgery. Again, this is a reasonable thought, but one thing to consider is just because glasses or contacts are working well for you right now, doesn't mean that they always will in the future. In particular, we know that contact lenses become more difficult with age from a comfort perspective, but also from the coordination required to put the contact in and out every day. There's really no wrong choice during cataract surgery, whether you choose basic or premium cataract surgery, regardless of what lens you choose. But you want to fully understand your options and you want to fully understand the long-term implications of those different options for your vision. Finally, that leads us to the last mistake that I see a lot of patients make around the time of cataract surgery. Mistake number 5, which is underestimating the importance of the postoperative care during cataract surgery. So after cataract surgery, you'll typically have multiple appointments that may be with your surgeon or with your primary eye doctor or optometrist. Sometimes patients may skip these appointments because they feel like things are going well or they're seeing better. It is extremely important to make sure that you're making all of your postoperative visits. While the risk of cataract surgery is low, there are risks like inflammation or infection that we're specifically watching for in that postoperative period. The earlier we catch a problem, the better we can treat it and the better prognosis for your vision to recover after the surgery. So make sure that you're on top of all of your follow-up visits with your doctor, because the postoperative care is just as important as the preoperative care or the surgery itself. If you or a loved one is getting ready for cataract surgery, hopefully this video has helped you avoid some of those common mistakes that I see patients make. Let me know in the comments below if there's any other questions you'd like answered about cataract surgery. This is the Cataract Companion channel, where my only goal is to help you feel confident about cataract surgery and get your best result. I'll see you next time.